Sir, can I start now? Okay, sir. Assalamu alaikum. My name is Afroz. I'm from Eastern Medicine Department, Government College University, Faisalabad. Today, I would like to share knowledge about some diagnostic tools which are used in Eastern medicine and used by Eastern medicine physicians in their clinics to diagnose the patients. In Eastern medicine, we check the patient's temperament first and also check the pulse. So today I would like to tell you that how we diagnose the patient's temperament and how to check the pulse of the patient. Firstly, I talk about temperament, then of course we'll discuss about pulse too. So what is temperament? The human body is made up of four elements: air, water, soil, and fire. And these four elements together affect each other's function. So the condition that arises after that is called temperament, and we say in Urdu mizaj. However, human body is made up of four elements, so the body's temperament depends on the ratio of these elements. That's why no one has similar temperament. Everybody has its own temperament according to the ratio of these four elements, which are air, water, soil, and fire. There are four types of temperament in human being: hot and wet, cold and dry, and hot and dry. And according to the philosophy of temperament, cold and dry, also called as temperament of earth or temperament of a dead person. Cold and wet, known as temperament of water. Hot and wet, also called as temperament of air or life. And hot and wet temperament further divide into four bands, which are cold and dry, cold and wet, hot and wet, and hot and dry. In these bands, hot and wet is considered as normal or ideal temperament of a person, while hot and dry is considered as near to temperament of earth, means patient is near to die or might have some acute or chronic disease. And if a patient is suffering from a cold and wet temperament, which is near to water, means patient might have infectious disease, mostly bacterial and viral infections is happening during cold and wet temperament. And hot and dry temperament is considered near to the temperament of fire. And if we talk about their diagnostic factors, that how we determine temperament in a function, so there are basically 10 factors that we include to determine or define the temperaments of a patient. So number one factor is touch. Through touch, we determine that is skin smooth or rough, is skin cold or hot, is skin healthy or unhealthy, is skin dry or wet, is skin have any kind of disease or not. For example, if you feel cold and soft surface, it means the patient's temperament is cold and wet. The second one factor is fat and flesh. This is the most important factor through which we diagnose the patient's temperament. The increased quantity of flesh in a body indicates hotness, while the increased quantity of a fat in a person indicate coldness in a body. For example, a fatty person have cold and wet temperament with broad chest, and a person who has more flesh as compared to fat, that kind of a person lies hot and wet temperament. In human body, reserved fat is present in the form of cold form. That's why the fatty persons are cold in temperament instead of hot. The third one factor is hair. We also check the texture, color, thickness or thinness of the hairs, and through which we determine the temperament of the patient. We check the texture, color, thickness, thinness, and quantity of hairs in our patient, which also helps us to determine the patient's temperament. Like if hair are black in colors, thick and more in quantity, it means the patient's temperament is hot. And if the hairs are thin, brown in colors, less in numbers, and plus hair loss problem is also present, it means that patient has cold in temperament. Mostly straight hairs indicate the wetness in the body, and curly hair indicate the dryness in the body. And too high or too low level of wetness in a body leads to the hair loss. So if a patient is present with hair loss problems, it means patient is suffering from cold and wet temperament. And according to Ibn Sina, thinning and softness of hair is a sign of coldness, and excess moisture and thickening and darkening of hair is a sign of excessive hotness in a body. The fourth factor is color of the body. If a patient comes to us in our Eastern Medicine clinic, we also check the skin, look at their skin color. So the white skin color is a sign of wetness. Red plus white color skin is a sign of hot and wetness. Bluish color indicates the extreme level of coldness in a body, while the wheat color or a brownish color considered as normal. For example, if patient's color is yellowish more, it means the patient's temperament is hot and dry, and more darker colors indicate cold and dry temperaments. We also look at the physique of the patient, which is one of the most important factor in diagnosis of temperament. A person who has a hot temperament will have a broad chest, hands and feet will be long, pulse will be great and strong, and muscles will be thick. And the person whose temperament is cold is fatty, has narrow chest, the skin is dry, and the veins are bulging. So we check the temperament through these temperaments. So through physique, for example, if a patient is a lean built person, so then the patient has hot and dry temperament. And if a patient has short muscles and very lean build and have no fat, then patient has cold and dry temperament. We also check the body's response towards hot and cold. If a person whose body part becomes hot due to any reason will have a hot temperament, and if they become cold, his temperament will be cold. For example, there are some people whose skin gets hot very quickly with the slightest touch or pressure, and the area becomes red and warm easily. And all this is a sign of a person's hot temperament. The seventh factor is sleep. We also determine the patient's temperament through their sleeping patterns. So, staying in moderation of sleep and wakefulness is a sign of normal temperament, and it is the another important factor which helps to determine the person's temperament. For example, excessive sleepiness is a sign of coldness and wetness, and short duration of sleep is a sign of hotness and dryness in the body. Eighth factor, which is organs activity. We also check the patient's organ activity. So as long as the function of the organs continue at a normal pace, it is a sign of moderate or normal temperament. Increased activity of organs is a sign of hotness, and decreased activity is a sign of coldness. For example, rapid growth of organs or rapid growth of nails and hairs is a sign of hot temperament. Excretion, which is the ninth factor, very important factor, and through which we can determine the patient's temperament. So if the wastes that are excreted physically are excreted in the right condition and according to the physical requirements, then it should be understood that the body's temperament is moderate. If it is exceeded, then the body's temperament will be hot, and if it is less, then the body's temperament will be cold. For example, if number of stools increases or urine frequency increases, or increase in anything which should have to be excreted from the body, like sweat, bile, hormones, etc., then the temperament of the body will be hot. And if it is the opposite, then the patient's temperament will be cold. The last one, and 10th number factor, is behavior. It is another point or factor through which we diagnose the temperament of patient or a person. For example, anger, happiness, sadness, bravery is a sign of moderate or normal temperament. And if a person is more jolly, then the temperament is cold and wet. More happiness is a sign of hot temperament. Now we talk about our another diagnostic tool, uh, is pulse. So to diagnose the pulse, we use the radial artery because it is easy to access. It creates no ethical issue for the patient, and it is near to heart. So the physician check the pulse of the patients through their hands by using four fingers: index finger, middle finger, ring finger, and little finger. We will discuss in detail. Index finger, if we are patient, if a physician feels the radiation on their index finger, and this radiation tells about the cervical region, like C1, C2, C3, and C4 related issues, neck pain, and shoulder region pains. And it also tells about the headache, and indicate, and these issues are indicated by the radiations on the index finger. It is also indicate the phlegmatic temperament, and if a pulse is Manshari, it will give the indication of the sinusitis, deviated nasal septums, and post nasal sinuses. And we also called the index finger in the Arabic language sababa. So through this finger we check or diagnose these diseases, like headache, phlegmatic temperament, shoulder and cervical region pains, neck pain, and etc. If we talk about the middle finger, the radiations on the second or the middle finger, which is also known as answer in Arabic language, will indicate the pathology of thoracic region and organs from chest to epigastric regions, which includes the stomach and liver, gallbladder, etc. If the pulse will indicate on second finger, it means there might be a stomach issue, liver related issues, or maybe IBS. In stomach, we see the hyperacidity, hypoacidity, gastric ulcers, epigastric pains. These are all included. And in liver, hepatomegaly, fatty liver, hepatitis, gallstones are included. And because the IBS, inflammatory bowel syndrome, is stress dominant, so the pulse will be feel or radiate strongly on the first two fingers. And the third finger, which is used by the physicians in checking the pulse of the patient to diagnose the diseases. So in Arabic language, it also known as a bansar, and in English, it is a ring finger. It tells about pain in lower body part, ache in the L4 and L5. These backaches also indicated in the second last tip of the finger, and if severe, then also feel on the first tip or part of the third finger. It indicates the issues of hormones, tells about the urinary tract infections, gynecological problems such as PCOS, dysmenorrhea, amenorrhea, abnormal uterine bleeding, pelvic inflammatory diseases, leukorrhea, etc. in females, and tell about the penis and prostate related pathologies and problems in males. The fourth finger, which is known as khansar in Arabic language, it tells about the lower leg pain and sleep related issues. Now there are some rules which are used to check the pulse, that are patient's heart should be aside, semi-flexed, thumb should be pointing superiorly and not adducted at armpit. pulse should be checked at time if of the at the time of the relaxation, and there should not be emotional effect on the patient. The patient should not be in hunger condition or with fullness of stomach. The patient should not be in a condition when he or she has quit any addiction or he or she has started new one. The patient's condition should compare with healthy person. Right pulse should be checked with right hand, and left pulse should be checked with the left hand. And it is recommended that all four fingers should be involved in checking the pulse. The patient's hand should be supported with physician's hand. Keep the four fingers on pulse and think about all types of the pulse, and be relaxed while checking the pulse. No need to hesitate, either all the work will waste. Physician should also be in relaxed position. There should not emotional disturbance. Fingers types of the physician should be soft, not rough or senseless. So use olive oil for the massage of the fingers to keep fingers soft. The physician should keep the extra temperamental conditions in his or her mind, which may misdiagnose the temperament. For example, consider the geographical conditions, weather, or other environmental factors. Specialized conditions of the patients also should be checked. Strong pulse should slightly compress, and weak pulse should not compress. Being busy during pulse checking is much discouraging. And while the patient has come in clinic, physician should note the condition of the patient first and allow him to relax. The physician should have smiley face, either the patient should be disturbed. So these all the rules should be followed by the physician mustly. There are some types of the pulse we analyze during checking the pulse. So firstly, we discuss about according to the quantity of the pulse. So there are nine types of the pulse according to the quantity. Number one, long pulse and short pulse. Second one and third one is the moderate pulse. In long pulse, length is longer than the normal length of the pulse, and if the pulse is long, it also indicate the hotness in the body. So by using the parameters of the pulse, we can also diagnose the temperaments. So if the patient has a short pulse, like the length is shorter than the normal length of the pulse, it is the indication of the coldness in the body. And if the patient has moderate pulse, not more lengthy and not more shorter, then the patient has the moderate temperament or a normal temperament. If the we also check the width of the pulse. If the pulse is more wide than the moderate, then it indicate the moistness, more moistness in the body. And if the patient has pulse narrow, less than the moderate, then it will indicate the dryness in the body. We also check the height of the pulse. If pulse is low in height, and it will indicate the sorry if we also check the hardness and softness of the pulse. If the pulse is hard, we say that it is solid, which is dry. And if the pulse is soft in touch, it is also known as lean, and we say that it is the moist condition of the skin. And which also check the height of the pulse, low height and high height of the pulse. So the pulse which is moderate and in between the height, we say that this is the moderate condition of the pulse. So this is all about my today's webinar. Thank you so much, Jazakallah. If you have any question, you can ask.